Good morning, everyone. Welcome to NRBP's Eye Opener and today's discussion topic, Mental Health, a Changing Landscape. Through the Eye Opener series, NRBP offers perspectives on timely business topics and introduces some of the Newark region's leaders and leading companies. This provides a special and unique opportunity for our members to hear from leaders who help them to be better informed on issues important to the city, the region, and to doing business. We're grateful to our series sponsor, RWJ Barnabas Health, and you will hear from them shortly. We also appreciate the support of our event sponsor, Horizon Blue Cross Blue Shield of New Jersey, and our media sponsor, NJ Advanced Media. It's now my pleasure to introduce Darrell Terry, President and CEO, Newark Beth Israel Medical Center and Children's Hospital of New Jersey, and RWJ Barnabas Health. Darrell is a past chairman of NRBP and has been dedicated and devoted to NRBP for many years. Darrell.
Good morning, everyone. I am really excited about today's program. I know three of the presenters very well, Dr. Budenick, as well as Denise Rogers and Bob Butsock. I'm really interested in hearing from Suzanne. I think we're in for a really important program this morning, particularly in light of what's going on in our world and what we've gone through. Just a couple of things about RWJ Barnabas Health and then Newark Beth Israel Medical Center. This month we celebrated the 5-year anniversary of us coming together as a one system, RWJ Barnabas Health. It has been a wonderful experience. We are the most comprehensive healthcare provider in the state of New Jersey. During these 5 years, we've treated over 20 million visits across multiple patient settings, inpatient, outpatient, emergency. We've delivered 120,000 babies into the world. We added a social impact and community investment core pillar to RWJ Barnabas Health. We have an Institute for Prevention and Recovery to help tackle the opioid epidemic. So we're excited about this partnership. It has been really ideal. The relationship with Rutgers is starting to mature and crystallize. And so this system has really come together in a really meaningful way. At Newark Beth Israel Medical Center, we have now provided over 1,100 heart transplants. This is a nationally ranked program that we are extremely proud of. We have become a leader in patient safety with 6 consecutive A ratings from the Leapfrog organization. We have been named by Newsweek World's Best Hospital for the 3rd consecutive year. Over the past 14 months or so, we've been fighting this COVID pandemic, and we've treated over 1,300 patients. And now we're really in the vaccine business and have given over 10,000 doses of vaccines to employees, physicians, and community members. We are addressing the social determinants of health through our greenhouse, our Reverend Ron Christian Wellness Center. And we're addressing the social justice issues that we're experiencing, and that has been a real challenge for us as an organization at the Beth, as well as throughout our system. As a matter of fact, it's such an important issue that there is a board subcommittee on anti-racism. There is also a steering committee led by our president and CEO, Barry Ostrowski, on ending racism together. And I sit on that committee as well as Dr. Budnick. So we have had many listening sessions and brought in world-class speakers like Denise for our social justice. We're very concerned about, the outcome of this trial and how, we will respond to that. At Newark Beth Israel, we've also appointed Atia Rashidi as the Chief Equity Officer at Newark Beth Israel. She's been with us for a long time and has really led our D&I program, but really wanted to expand her horizon and really make sure that everyone knows how important that is to the overall success of Newark Beth Israel. And then finally, I spoke about this before, we are embarking on what was a $100 million plan is probably closer to a $150 million project now. And we have started in earnest, and anybody who travels through this area, you'll start to see cranes on Lyons Avenue in the next 2 weeks, which I'm extremely excited about. So I don't want to take any more time because I really want to hear from the speakers because this is a very important topic and timely as well. So thank you, Barbara, for the opportunity to address the Newark Regional Business Partnership.
Thank you, Daryl. We always appreciate the updates on RWJ Barnabas Health and Newark Beth Israel Medical Center. There's always exciting things happening, so we really appreciate it. And in terms of the last item that you mentioned, the renovation, Laura's opening slide has a picture of what the new facade of the hospital will look like. And I think all of you will be very excited to see that because it's really opening the front door. It's a very, very beautiful image. We selected today's topic because we understand that it's impossible to isolate the stress, anxiety, worry, and pressure so many of us are experiencing in our personal lives from the workplace. So employers have the opportunity to think about how they can help their teams. And in designing today's program, we asked the question, what can employers do to help? And to do that, we needed to understand the experiences and things that are happening. And so our speakers are going to delve into every aspect of the things that are going on, all of the factors that are colliding together to influence how all of us are experiencing, feeling, and the impact on our mental health. I think it is a very important topic, and we're proud to be able to offer it. We think that we've got an amazing assemblage of speakers, and I can't wait to hear what they have to say. Before I introduce our moderator, a few housekeeping items. All of you are going to be off screen and muted throughout the program. There is a Q&A box, and you can put any questions in there. We will only address those if we have time, but I assure you we will address those questions if we need to after the program to be able to direct them to our speakers. You will be getting a thank you email, and in that thank you email, there'll be a link to the recording of the program. If you want to listen or if you want to share it with others who were not able to attend, we hope that this will be meaningful to you and to everyone you work with. At the end, Chip Halleck will conclude the program, and I am delighted now to introduce our moderator, Stephanie Olekson with PSC&G. Stephanie, it's all yours.
Thank you, Barbara. As we begin to open up today's discussion, and you know that many of the participants today and what we sort of contribute in our workplaces, I think we would all probably agree that last year has been the most challenging from a professional and in many cases a personal standpoint. So no matter what industry, what your role is within the HR space, or where we find ourselves working across the state, we were faced with solving new problems that in many cases were contrast to what we were accustomed to previous to COVID. We navigated issues of remote work, paid time off, safety protocol, travel quarantines, contact tracing, and the list goes on. We went from a world where we were controlling absenteeism to almost encouraging it when there was any doubt of a COVID exposure or illness. So more than a year later, those earlier challenges are now part of our norm, but you sort of are in a position to say, what's next? Although we are resilient and have been able to keep our businesses running for the most part, it is time to look ahead and identify what some call the pandemic within the pandemic. I know I'm excited about the discussions lined up for today, and I'm honored to introduce our first speaker, Dr. Denise Rogers, representing Rutgers Biomedical and Health Sciences.
Thank you, Stephanie, for that introduction. And I'm now going to hope the technology works as I share my slides. So part of my goal this morning is really to give us some context for the conversation. We're all very well aware of the impact of COVID, but perhaps not fully aware of the entire impact. And the first thing that I want to remind us all is that COVID was the third leading cause of death for 2020, with 345,000 people dying in the year 2020 from this disease. I also want to remind us that as of April 18th, there have been nearly 32 million cases of COVID in the United States, with over 560,000 people dying from COVID. And it is estimated that we potentially could have 600,000 people dying from COVID before the summer is over. Here in New Jersey, we have had 858,000 plus cases of COVID. As most of you are aware, we were one of the states that was most severely affected in the beginning days of the pandemic, but then we saw a second wave, and we are actually now in a period of having increased cases compared to many other parts of the country here in New Jersey. We have lost 25,000 people from COVID. One of the good news parts of this story is that we have learned how to better treat COVID since the early days of this pandemic, but still we continue every day to have people die in our state from this disease. What we also know in the state of New Jersey is that this disease impacts different people by race, ethnicity differently. So when we look at age-adjusted data, we see that Hispanic and African American people in New Jersey are more likely on an age-adjusted basis to be diagnosed with COVID. They're more likely to be hospitalized, and they are significantly more likely to die from COVID when compared to their white and Asian counterparts. In the United States, African Americans are about 40% more likely to die from COVID. And American Indian, Alaska Native populations, as well as Hispanic populations and Pacific Islanders are also all disproportionately impacted by COVID in their death rates. To date, about 3,607 healthcare workers have died from COVID. Of the healthcare workers who have died, the majority are African American or Asian or Hispanic. What we also see in the country as a whole in this slide is that African Americans and Latinos, as well as American Indians, are disproportionately impacted, again, nationwide from COVID deaths. We know that certainly in my field as a physician, that COVID-19 has played a very heavy toll, has taken a heavy toll on the mental health and well-being of healthcare workers. This is a study that was done by the Kaiser Family Foundation. It was published in February, and it is a way to help us quantify the impact on the population as a whole of the COVID pandemic. What we see when we compare January to June 2019, which is a pre-COVID period of time, with January of 2021, obviously in the midst of the pandemic, that the average share of adults reporting symptoms of anxiety disorder or depressive disorder is almost 4 times as great, 11% of people in 2019 compared to 41% of people in January 2021. We see that the share of adults reporting symptoms of anxiety or depression, again, very high, with about 35%, 36% of people having anxiety disorder, 28% of people having depressive disorder, and again, 41% both. The share of adults reporting symptoms of anxiety by age, one of the things we need to pay a lot of attention to is that younger populations are having even greater levels of mental health symptoms during this pandemic. So those 18 to 24, 56% of them are reporting anxiety and depression. Nearly 50% of adults ages 25 to 49. And again, as you can see, the group with the least amount of report of depressive symptoms are adults ages 65 plus. But again, nearly 30% of them are having symptoms. If we look at the relationship between mental health and job loss, it's not surprising at all to see that those who have lost their jobs are reporting more mental health symptoms than those who maintain their jobs. What we also see is that while mental health symptoms are found throughout those of various socioeconomic status, those who are poor are more likely to say that the COVID pandemic has had a major negative impact or a minor negative impact on their mental health when compared to those in higher income brackets. We also, not surprisingly, see that households with children under the age of 18, many of those households having to grapple with homeschooling and the like, they have higher rates of mental health symptoms. And not surprisingly, again, women are more likely to be impacted than men, close to 50% compared to 40% of men. If we look at the share of people reporting anxiety or depressive disorder by race ethnicity, we see other non-Hispanic, which includes American Indian and Alaska Native Pacific Islanders, for example, have the highest rates of anxiety of depression reporting, followed by African Americans, followed by Latinos, and then followed by whites and Asians. So we see that people of color in the United States have been more adversely impacted in their mental health than whites and Asians. Again, not surprising data. Essential workers compared to non-essential workers, essential workers having higher rates of mental distress and substance use during the pandemic as well. We know that the pandemic has fueled alcohol abuse, and one of the measures for that in the healthcare system is that we see increased rates of hospitalization for liver disease. What we also see from this reporting in the New York Times from last week is that overdose deaths have surged during the pandemic. And we also must be reminded that opioid use and overdose have been a significant problem in this country for the last decade. What is a change is that there was a period of time, 2014 to 2018 or so, when the opioid epidemic seemed to disproportionately affect white populations. What we see now is that the highest increase in mortality from opioids is predominantly driven by fentanyl and is now among Black Americans. What we also see is that the risk of dying from methamphetamine overdose is 12-fold higher among American Indians and Alaska Natives than other groups. So again, communities of color being disproportionately impacted. I want to close by reminding us that 1 in 3 COVID-19 patients, so people who've had COVID-19, are diagnosed with a neuropsychiatric condition in the 6 months following their diagnosis. Most of these people are diagnosed with anxiety or depression. However, we also see some being diagnosed with strokes and others with dementia. So the disease itself can lead to mental health issues as well. I can't leave my talk as a Debbie Downer, and so I want to remind you that we are making progress here in New Jersey in administering the vaccine. 3,777,000 people have gotten at least one vaccine dose, and almost 2.5 million people in this state are fully vaccinated. And certainly everyone who is listening to this, the vaccine is now available to all adults in the state, and I urge you to get it as soon as you possibly can. Thank you.
Hi, everyone. Good morning. Thank you, Denise. I'm going to piggyback right off of your very important presentation that really highlights the disproportionate impact of COVID across races and mental health issues in particular. And I think it's important to realize that there's a number of different diagnoses that can be diagnosed or identified through the course of the past 18 months that people are experiencing at different times. But overwhelmingly, as we look at our employees here, we have more than 4,000 employees at Newark Bath. The sense of just ongoing stress, and not just at work. These are stresses that people have at home too. They are providing childcare or maybe care to an elderly person in their family because that care isn't available outside of the house during a pandemic. So I think people are really stressed. They are feeling overwhelmed with the number of things that they are charged with taking care of, and they're concerned about their own health and well-being. So in getting to the root of what are some of the things our employees are experiencing, it's best described across the board, not diagnostically for a group, but as burnout. People are emotionally, physically, mentally exhausted. They have had stress that's chronic and acute over the last 18 months across multiple areas of their life, and they don't often feel like they have any control in changing the outcome of what is. And highlighted in the pandemic is the issue of race and racism. And we see that in structural areas and access to care and who's an essential employee and what are the resources available to people. So you can't really talk about the impact of mental health and COVID-19 without addressing and acknowledging that race and racism has a huge impact on how people are responding and experiencing the pandemic and their mental health through the course of the time. What are the reasons why we're seeing 1/3 of women of color ready to leave the workforce by next year? When they surveyed nationally a group of women, there was a sense of burnout and a lack of psychological safety in the workplace. And the second top reason was because they felt they needed to do something that aligned with their view of the world. It had to feel important. It had to feel that it was serving a greater purpose. And I think that this was something that employers should really realize when it comes to their employees. What are you looking for? Is really making sure that you are deliberate in your discussions with your employees. What is it that is keeping them from feeling either engaged or safe in the workplace, particularly women? And what are the changes that you're making in the employment setting to make sure people feel connected to a greater purpose? Here, we've had employees who clearly were impacted by the amount of stress of coming to work and being, let's say, a nurse in the ICU or a nursing assistant or a respiratory therapist. And some of the mitigating factors for them was understanding what they were doing was helping someone else, and that would become a mitigating factor. So I think it's really being deliberate in how we're talking to our employees and making sure we understand what are the things that are keeping them from feeling safe and engaged. Psychological safety. This is very important for women in particular. If people don't feel safe in the workplace in order to say what they're thinking, they will not be creative. They won't stay in the job. And they tend to just stay quiet, and they'll find a different strategy to get their needs met elsewhere. And in particularly, women of color feel, when surveyed, the sense of saying something in a group meeting without having evidence or real data. Let's say maybe they don't feel safe enough to bring up what their experience is or what they'd like to see different. So I think there needs to be an awareness of that and making sure we're creating safe spaces for people to speak. Here, Mr. Terry discussed Atiya Jaha-Rashidi, who is now our Chief Equity Officer, and that is a first time position here, and definitely one that Atiya has always been doing, and now she just has the official title of doing it. And it's really about creating an inclusive environment. And although when you survey nationally, companies all agree that diversity and inclusion are important to them, when you look at, do they really have goals, measurable goals that are driven to that end, only 55% of companies really had goals to address issues of diversity. You want to make sure that your internal culture and practices match what you say. You want to have goals that are measurable, and you want to ask your staff to talk about the practices that are not equitable and survey and have them participate in planning for how to make things more equitable for them in the workplace. The last thing I want to talk about really is the difference between therapy and therapeutic activity. And this is something that's worth noting for employers who tend to, and we've done it here as well, move toward an EAP when you see someone struggling, whether it be burnout or particular symptoms, or they have a family member that they're coming to you about. And we talk about EAP, which is an important resource. There's also therapeutic activities that I think we want to make sure are available to our employees, and we want to make sure we're promoting them as well. So here we have workplace business resource groups, or BRGs. And these are a place for people to feel that they're connected socially with their colleagues, that they're doing something that's meaningful to them on a personal level. You want to have social events and you know, where they have to be computer-based and Zoom-like, you do that, but where they can be in person, socially distanced, that's very important for people. The isolation, it really has an impact on people over time. Things like taking group walks outside, you can organize these things, and they will help bolster camaraderie, a sense of well-being, and really help the mental health experience of your employees. Here at NORCBATH, during the peak of the pandemic, we created spaces where people could come and just do something different, distracting and therapeutic, whether it was a puzzle or it was painting or it was smashing mugs and putting them back together and decorating them, but creating spaces where people could do things that were not work related, but definitely meant to be for them and a moment to restore. And finally, there are a number of culturally based healing circles, which are relevant to different groups, and they're run not by licensed professionals, but by peers who provide a setting so people can talk about their experience and what's happening. And here in healthcare, we do something called Schwartz Rounds. And Schwartz Rounds are meant to be facilitated discussions by a panel of people and get the group of staff participating to experience and share what their experience has been as a healthcare employee, regardless of their role. So there'll be times the panel will have a physician, a nurse, a housekeeper, and a registrar, and they're all talking about the same topic and their experience. And then the staff from the hospital participates. It's a very validating experience that is therapeutic, but not necessarily traditional therapy. So there's a number of things we can do. I think that this discussion will further demonstrate different things that we can offer to our employees to keep them well and healthy, and acknowledge when things are happening for them personally at home and at work that we have a responsibility to address. Thank you.
All right. Good morning, everyone. Maya, thank you for sharing my screen. I would like to acknowledge the sponsor of this morning's event, Daryl Terry and Newark Beth Israel Medical Center. Daryl is a role model for me and a mentor to me. And I also happen to be a Beth baby. Somebody was born in Newark Beth Israel Medical Center. So the Newark Beth definitely holds a special place in my heart. And what I want to talk about a little bit, so I'm president and CEO of Integrity House. I've been with Integrity House for 36 and a half years. Integrity House has been around since 1968. We started here in Newark, New Jersey. We also have locations in Kearney, Morris Plains, Paramus, Secaucus, and Toms River. So our sweet spot, Integrity House, is providing addiction treatment, but we also work with individuals who have other issues, mental health issues, physical health issues. And our goal at Integrity House is to help people rebuild their lives. So I have a couple slides that I wanted to discuss real quickly. These slides are it's information from the Kaiser Family Foundation. And in fact, if you could just continue to advance that and continue to advance it to the essential workers. One more slide. Yeah, right there. Okay, very good. So Dr. Rogers already shared some information from the Kaiser Family Foundation, and they've done research on the impact that COVID-19 has had on our lives. So if I go back a year ago, March, April of 2020, that our world was completely turned upside down. And that in addition to the COVID pandemic, we also had an epidemic of fear, uncertainty, and anxiety. It definitely impacted all of us. I know it impacted me as an individual, and for everyone participating today, I'm positive that it has impacted you. You may not even realize it yet, because we need to continue to just put one foot in front of another and do our job. I know here at Integrity House, I've continued to come to work every day for the past year, and I have an organization to run, but at the same time, I recognize that what's happened in our world has had an impact on me. There were sweeping ramifications from COVID. Financial, educational systems were disrupted, employment systems were disrupted, physical relationships. We weren't able to connect with one another in a social way. We had death during COVID. And in many situations, we were not with our loved ones when they passed away, and we did not have the opportunity to grieve in our traditional fashion. So our world has completely been turned upside down, and there are ramifications. So, when we look at these slides from the Kaiser Family Foundation, this is a snapshot of essential workers and non-essential workers, the share of adults reporting mental distress and substance use in June of 2020. Remember, the pandemic hit us in March and April of 2020 was when it really hit the United States hard. And what we're seeing here is probably just the tip of the iceberg. So, with an iceberg, 20% of the iceberg is above the surface, 80% is below the surface. So we have some research, and we're sharing some information here about the impact that COVID and the associated problems has had on all of us. However, everyone should be mindful that this is the beginning, that we're seeing, especially when it comes to essential workers. And that's why I wanted Maya to stop at this slide, is that when you look at essential workers versus non-essential workers, that the folks that had to continue to come to work every day, working on the front lines of healthcare and working in grocery stores and home supply stores, those folks that had to continue to come in every day and take mass transit in some cases and carpool, that they experienced greater symptoms of anxiety and depression, that they started or increased substance use to cope with the stress or emotions at a higher rate than non-essential workers, and also seriously considering suicide. That when this survey was administered, that 22% of essential workers said that they considered suicide in the past 30 days, 8% of non-essential workers. So I just wanted to show the comparison between the two. It's really, it's had a sweeping impact on all of us, but I just wanted to accentuate that. If you go to the next slide, Maya, it's a little bit about, this is just a quick snapshot. This comes from the American Journal of Drug and Alcohol Abuse. And that, just a quick snapshot, about 2,000 respondents, and 32% of those respondents indicated that they had more binge drinking during the pandemic versus pre-pandemic. And I know just from folks that I've worked with here at Integrity House, family members that have reached out to me, friends that have reached out to me because they were concerned with their loved ones because they were increasing their alcohol use during the pandemic. Everyone was kind of sheltered in place, they were isolated, and that led to increased alcohol use. On the next slide, we're just going to talk about a little bit about the difference between someone who goes home at the end of the day and has a glass of wine with their dinner, and someone where alcohol or drug use becomes a serious problem. So, on one end of the spectrum, you have, casual, recreational, limited use. And that is somebody that has a couple beers on the weekend, a glass of wine at dinner. And then there's a continuum that goes all the way up to dependence. So you have substance use, substance misuse, tolerance. Once you reach the point where, you need more beers to get the same effect. And let's say that, you're continuing to drink in spite of impaired functioning, where, the family is complaining and the family saying you need to cut down, but you continue. That is classified as substance abuse. And then you have addiction and dependence, where actually you need to use the substance just to feel normal, just to go to work every day, that you may need a drink in the morning before you get to work. On the next slide, again, this is really getting into the details, clinical details that really Dr. Budenick and Dr. Rogers and others, have a lot of experience. And this is actually, substance use disorder criteria. So, the diagnostic criteria is listed, and there's actually 11 areas that are evaluated. And, for somebody that meets, 2 or 3 of these areas, it's definitely a cause for concern. However, there's no need for a serious intervention. However, if you see that people, are wanting to cut down or stop using, but they can't cut down, attempts to control use, they're continuing to use even though it's causing problems in their relationships, and they're using the substances again, even when it puts them in danger, and they're needing more of the substance to get the same effect that you want, you have a problem. And then could you switch to the last slide, Maya? The other thing that I want to say as I conclude here is that, as an employer, really what we need now is, so we've presented all the data that yes, COVID has turned our world upside down. It has impacted the lives of all of us and many Americans. And as an employer, we need to recognize that. And we need to lead and manage with empathy. That's a word that I'm hearing a lot recently. I'm using it a lot recently. And we need to really emphasize the self-care of our employees. Thank you.
Suzanne, you're muted. You're still muted.
Can you hear me?
Yes.
Okay, great. Thank you. Thank you so much. Sorry about that. So again, Suzanne Kunis, Vice President of Behavioral Health at Horizon Blue Cross Blue Shield of New Jersey. Thank you, Barbara, for inviting me to be part of this panel this morning. It's been amazing to hear the information that's already been shared by my co-panelists here. I just want to start on the first slide here, just very briefly, because some of these points have already been made by others on the panel. So if you go to the next slide. You know, we've all seen the headlines. They've been endless. It's been a significantly challenging year in so many ways. We've heard about the Kaiser Family Foundation and some of the survey results that they've had. Recently, we've just read one that said 50% of the general population meet the criteria for depression and anxiety. That is huge as compared to, we've always been hearing 1 in 4 or 1 in 5 Americans are experiencing something, a mental health issue in their lifetime. Over 90,000 drug overdose deaths in the United States, which is a 20% increase over the prior year. So as much as we had hoped we were going to be making progress, and we had shown some evidence of progress in, let's say, 2017, 2018, it was a huge backslide here. As Bob mentioned, we're seeing lots of people increasing their use of substances, alcohol, et cetera, just to be able to cope with the emotional distress related to COVID. Over 3,000 suspected overdose deaths here in New Jersey. And I mean, unfortunately, none of us are immune. And this weekend, I arranged the memorial service for my nephew, 35 years old, who had struggled with primarily alcohol, but then moved into drugs. And no matter how much time and effort has been placed on trying to get him and others of his friends to a better place and showing that there's hope and help, he succumbed to the disease. And it just shows you that no matter who you are, no matter what walk of life you're in, we're all impacted by this. None of us, again, are immune. Then we talked about suicidal thoughts. And I think that we've seen evidence of an increase in suicidal thoughts, but most interestingly and sadly, is that in the age group of 18 to 24, the increase has been from 10.7% in 2018 to 25.5% in August of 2020. So the situation is just very dire, to put it mildly. And then we already had an issue of supply and demand in behavioral health. I mean, in 2015, they published data at the American Academy of Medical Colleges saying that 60% of psychiatrists were over the age of 55. So a really small supply has continued to become even more scarce, and worse so during COVID. We just can't create enough psychiatrists or create enough behavioral health clinicians in the short period of time that we're going to need to be able to fill the gap or to address this tsunami that we're talking about. So there are so many different ways we're trying to work through finding other options, how to extend the treatment team, how to involve primary care practices, et cetera. So let's go on to the next slide. And I know that Denise mentioned earlier she didn't want to be Debbie Downer, and I felt the same way. I wanted to at least say there have been some silver linings and that we've seen as an insurer. Stigma reduction, and I'm going to talk more about stigma. That is like the number one reason why people don't get access to care for behavioral health. And again, it's understanding anxiety and depression, isolation, loneliness, et cetera. So the great news is there has been progress in this area. Telehealth providers pivoted overnight. I just can't tell you how proud we were of all the providers in our network and in the community at large that really literally overnight became virtual care providers. Prior to COVID, from an insurance perspective, we saw telehealth services were reflected in only 1% of the professional office visits in early 2020. Currently, it's in the excess of 60% and climbing, and we don't expect that to change, and we don't want it to change because we think it's been such a huge benefit to the people who are struggling with mental health and substance use issues. No-show rates. So prior to COVID, we had providers telling us that there were 40 to 55% of their outpatient services were no-shows. But yet during COVID, we've heard the same providers telling us that has turned into less than 20%, which is phenomenal. We've seen kids greatly engaged in treatment for the first time in many years. Recovery meetings have had, thank God for them, for individuals who are already in recovery and trying to stay in recovery and deal with the stresses of COVID. The reports that we're getting are that there are 5+ times as many people attending virtual recovery sessions as had been in-person care. And then the fact that there are lots of that we tried to bring to our clients and our employees, quite honestly, are digital and virtual solutions that the market is ready for. Lots of entrepreneurs out there, lots of VC money behind them, which means that some of that, so that's great, some not so much. We have to just really watch and actually weigh the benefits before we introduce them to our members and our employees. Let me go to the next slide. So as an employer, these are some of the things that we wanted to make sure, not just for our own employees, but also for the community at large. Again, I mentioned already the rapid change overnight to telehealth. We've also done a great amount of work in terms of increasing access via virtually contracted provider organizations. So we have one of our specialty provider partners that's out there that has been doing virtual care for several years for us and others, basically became an outpatient treatment provider, so we could provide access to outpatient services much more easily by giving folks an opportunity to opt in online to get connected with a virtual therapist, and the turnaround was amazing. We introduced new medication-assisted treatment programs here in New Jersey. So they're full-service medication-assisted treatment programs that it's more than prescribing, right? So someone who's struggling with an issue, an opioid addiction or whatever, that's in care, it's not just prescribing. It's not all about prescribing the medications, the buprenorphine, et cetera. It's making sure that they get all of the other supportive services that are needed to actually get into recovery and stay in recovery. We've put together specialty programs for first responders and frontline health workers. Again, some of these are virtual, some are brick and mortar, but really recognizing the great need that we've talked about earlier on this call. And then we also are looking at specialty programs. We've launched a virtual OCD program, and we will soon be launching a virtual eating disorders program. So again, trying to bring solutions to the very many different conditions that our members and our employees experience every day during this difficult time. We've also taken a larger stake, if you will, in the peer support market and contingency management programs where people are rewarded for doing the right things to be able to manage their disease, and educating and empowering the employee base as well as the community at large. We did convene an expert panel of individuals to address not just COVID, but as we all spoke about earlier, race and racism is such a huge issue that happened to all coincide together with COVID. And we thought we wanted to pull people from around the country into a group to really talk about what we all can do, again, as employers, as consumers, as members of this community. So there's a huge amount of work that's been going on and that we will continue to do. But let's move to the next slide. Because I think as an employer, these are some of the things that we want to make sure that employers focus on. As I said earlier, if you do nothing else, stigma is an area that we all need to pay attention to. And it can't just be lip service. I mean, I live in a town that says we're a stigma-free community. There are lots of signs on the street corners, but no one in this town actually knows what that really means. So we can't just provide lip service to stigma. We have to actually sit down and put together plans within our organizations as employers to be able to have people understand that the issues that you're facing in terms of mental health or substance use are just like people who have the same issues of diabetes and heart disease. We want to talk openly about mental health. If you can possibly use your own stories or to find ways to let employees know that it's okay to talk about this. And again, the old, it's okay not to be okay. Educate yourself and others. There are, so many times we talk about people, and again, this is the next one about language. Language is so important. We can't talk about people being crazy or call psychiatrists shrinks. It's all the negative connotations that go around that we as employers have to be so mindful of and really put some boundaries in place in our organizations, but also have them understand that there are ways to deal with all this, and be honest about treatment. It's okay to get treatment. It's great to get treatment, and don't have people fear that they're going to be judged. Next slide. This is from a recent article in the New York Times. This is a real issue. It's about 8 exercises to strengthen your social muscles. It's dusting off your social skills. This is a real issue. I have a son who lives in London. He was in a park and saw a woman with her 2-year-old child. And the 2-year-old turns around to mommy and says, "Uh-oh, mommy, people." And that's a 2-year-old child. Just take that now on up through what's that child's life going to be like going forward? How does that child get to the next level, if you will, as they grow up and have to go back to quote unquote the new normal. So this was out of a New York Times article. It's easily accessible, and I just wanted to share with you some of the suggestions there. And then lastly, if we could just go to the last slide, it's okay to get help. Please get help. There are lots of treatment options for people with mental health conditions and substance use issues. There are the general watch your diet, your exercise, et cetera, but also just talk to your primary care provider. If you don't want to see behavioral health clinicians, just encourage your people to talk to their primary care practice, because in New Jersey, we're trying to help equip them as well with all the services that they can possibly access when someone walks through their doors. And with that, I close, and thank you again for the time today.
Hi, Stephanie. We cannot hear you. Barbara, you are muted.
Okay, sorry about that. This was an audience question for Laura. A school psychologist wrote that she was intrigued by the Schwartz rounds, and I thought perhaps I could put you in touch with her. She's interested in knowing whether there's a template that you would be able to share.
So I'm happy to be in touch with her. My background also is as a school psychologist, and I do think it would translate well to a school setting. I will tell you that Schwartz rounds are intended for healthcare settings, and they are formalized rounds. So there's not a template, but there is a training process, which I highly encourage her to look at and maybe engage her school. But I'm happy to provide real feedback and links to who she can get more information from on Schwartz rounds. They're very meaningful here.
Great.
Laura,
Okay.
can remind her about the website. They have a great website as well.
Yeah, I'm going to send her all the links on the websites, and they do the formalized training. You get a coach, you get a partner. They stay very in touch with you as you roll out the program.
Great, thank you. Do we have Stephanie?
No, not yet. We're having an audio difficulty at the.
Okay, all right. And I have that school psychologist's email, so Laura, I'll provide that to you. I just to keep the program moving, I have the questions, and I can go into the first one, which is what actions can people take to promote their own mental health? Some of you were talking about the importance of self-care, such as mindfulness and stress management. What are some sources that employers can reference to help their employees learn these techniques? And I'll turn that to anyone.
So as a family doc, let me start by talking about the obvious, which is exercise is a big one. And also diet, for that matter, is important. So watching what you eat, not over caffeinating, that sort of thing. The other thing that people should be encouraged to do is to engage in a mindfulness practice. One of the things that Laura referenced are sort of this year has been a year of complex traumas. So we've had the trauma of COVID, we've had the trauma of racism. Many people have had the trauma of significant economic losses. Obviously, many people have lost family members, in addition to a subset of people being encouraged and needing sort of formal professional help. There are some self-care behaviors that people can engage in. One of my colleagues runs a business and got a subscription to the app Calm for all of her employees, so that there was a sort of formalized training program to engage in mindfulness. And I think having employers think outside of the box in terms of how to offer things that can help people to help themselves is important from my vantage point.
I want to share on top of, exercise and eating well and taking care of yourself physically and being in tune with what you are experiencing in the moment are extremely important learned skills. They don't just happen automatically. In addition to that, I have to say the thing that I think is probably the best safeguard against all that came with this pandemic is connecting with others. The isolation, physical and social isolation, really just has exacerbated any pre-existing condition a person may have, or a predisposition toward developing it. So that movement away from people really fosters the aloneness and the loneliness that creates a lot of anxiety and sadness for people. So being connected, having those business resource groups or group discussions, activities, having people have the opportunity to talk to each other. The action of talking in therapy is really one of the catalysts for wellness, that you have to actually put your thoughts and emotions into language, which helps you organize what you are experiencing. And then you get feedback from someone else who can either validate, share, or maybe give you a different way to think about it. So really connecting with people, and if it has to be virtual, that's still better than the isolation and separation that we've experienced through the course of this.
Suzanne, you're muted.
Having trouble with the phone and the computer here. So for we mentioned it before, there are lots of people organizations that have employee assistance programs. I would totally bring those organizations into your organization, have sessions with your employees. They can do brown bag lunches. They can do all kinds of things to really try to make services and an ear very accessible. And I'd go back to this New York Times article. I just kind of breezed through it, but it's called "Need to Dust Off Your Social Skills?" ? Very simple things. Share food with somebody, tell a joke, or get people to laugh. They say laughter is the best medicine, right? Ask somebody what they're listening to or reading. Reach out to somebody you've lost touch with. Go for a walk. I mean, we have team meetings now. I do 2 team meetings a week with my direct reports, and we literally, one of those is walking outside with everybody with their headsets on, or AirPods, et cetera, just to get outside and we can all talk. And we don't talk about work for the most part. We just talk about being people in our families and things like that. And plan things for the future, because people need to know there is a future. We have a future, and every day is a new day. The other thing is there's a resource, as an organization called Psych Hub, PSYCH, Hub, HUB.org. They have tons of resources there for employers, for individuals, et cetera, to help with just any area you can possibly think of in the mental health or substance use realm. So I would really encourage people to use those kinds of resources to be able to get information for their team members.
Bob, do you want to address that question as well?
Sure, I could add to that. I know, here at Integrity House, we're in the business of treating addiction and mental health issues. So it's what we do every day, and we always talk about self-care. We've been talking about self-care forever, but I think it's a little different right now. Like, it's not just a suggestion, self-care. It's that, those that have been putting it off, the exercise, the mindfulness, the paying attention to what they're eating and how that makes them feel. And also accessing programs like the EAP program that we have. We started every other week we send out a newsletter on wellness. Just, it'll have some recipes in there. It'll have some tips. And we are really, really placing an emphasis on good self-care. And again, I can't use the word empathy enough in terms of, what leaders are bringing to the workplace every day, that we recognize that we have a workforce that has experienced trauma over the past year, and that we demonstrate empathy, and that we really continue to pound the drum about self-care. And that is how we are going to get through this, is that, acknowledging, yes, we have all experienced trauma, and also that that self-care and connecting with others is how we're going to get through this together. And also, in addition to, and I think Suzanne mentioned some tips there, that, it doesn't always have to be professional help. It doesn't have to be a therapist that you're going to, because some folks, aren't open to going to a therapist. And if they don't need it, if they're not ready for that step right now, there are a lot of other things that you could do to just connect with other people. Virtually, or hopefully we're going to start connecting more in person. And I think that you're doing that because it's something you get enjoyment out of, connecting with others, and also it will help with self-care, reducing the isolation.
Thank you. That was really very insightful and helpful in sharing those techniques. Our next question I have for Denise. We've all heard a reference to long haulers and those who recover after what might be a long hospitalization and the continued stress they feel. Their physical symptoms, but there are related emotional and behavioral impacts. Can you discuss the various impacts of the pandemic, particularly with this group, on behavioral health?
Yeah, I think one of the things I referenced earlier is there's clear data now that suggests that one of the side effects, if you will, or the long-term consequences of COVID are mental health disorders. And so, again, the most common being anxiety and depressive disorders, not again necessarily related to what we think of in terms of the life issues going on for someone, but literally it's the physiologic impact of this disease. And we know this because we also see a subset of people who develop dementia post-COVID. And as I mentioned earlier, there are a subset of people who also have stroke as part of COVID. One of the things, the conversations I'm fascinated by, as an aside related to the J&J vaccine, is that we're very worried about the stroke with the people who've gotten that vaccine, which, don't get me wrong, is something we should worry about. But the risk of stroke from COVID itself is much greater than the risk from these vaccines. And so we don't think about the totality of the impact of the disease itself. We also, unfortunately, don't know and can't predict who sort of the so-called long haulers will be. We also don't yet know how to predict how long these side effects will be. We know that there are indeed a subset of people who, for example, will have post-COVID related depression and anxiety who get better. And so I don't want to imply that if this happens to you, it's a lifelong phenomenon. But for some people, it certainly is longer than we would like. It can go on for months and months and months.
Thank you. Thank you for that. Bob, you see people who have substance abuse issues. have you seen people revert after treatment because of conditions relating to the pandemic?
Yes, we have. And what we have seen, and I think that Laura mentioned this earlier, is that really, what we were asked to do as a country a year ago was to isolate, to, social distance, to stay in our homes, only go out when necessary. And I know that many individuals who were in recovery from alcoholism or substance use disorders, they were still staying really healthy by socializing, by networking with other individuals who had a common goal of maintaining good mental health and staying sober. And yes, there was a pivot to virtual connections and Zoom connections. But at the same time, many individuals that were either in recovery, or if they were struggling with a substance use disorder or an alcohol use disorder, it actually, the problem exacerbated during the point where we were asked to stay home and to social distance from others. So we've seen an uptick, for a period of time, the spring of last year, not many people were reaching out for help. They were isolating, they were delaying getting help. But we've seen an uptick, in the months that followed, where individuals are needing to get back engaged in mental health services and addiction treatment services because they, had a setback during the pandemic.
Thank you. So the next question is for all of the speakers. And many of our listeners today may be employed by smaller companies, and they may not have an HR specialist or a big HR department. Their EAP programs may not be very comprehensive. So how can employers help employees at these companies? And how can employees find the help they need, including, the access to self-care, if we're sort of in that smaller employer environment? Denise, do you want to start us off?
Yeah, I mean, I think that obviously there are online resources that are available for people, things like Psych Hub, for example, and there are phone-based apps, things like Headspace, Calm, that sort of thing. One of the things that occurs to me, though, as I'm listening to our conversation, and I'm putting myself in the space of an employer, is I don't want people listening to this to think that we are sort of these unrealistic pie in the sky people that believe that no matter what your employee is going through, you have an obligation to sort of take care of it. You run a business and you need people to perform in order to keep your business going. And I think what we're suggesting is that we urge you to have as much compassion and empathy for those who have mental health issues as you do for those who have physical health issues. And so most employers are able to make accommodation for diabetic patients, for example, diabetic patients, this is me, the doctor, diabetic employees who, may need to eat at certain times and that sort of thing. We urge you to have those same supports for people with mental health issues. On the other hand, we also understand that a subset of people may be impaired to the point where they can't continue to work. And we urge you to point them in the right direction where they can get help. Because I think often, as we do our work, we focus so much on the need for compassion for the employee, and there is a need for compassion for the employee. We forget the realities that you as employers have. And I just want to make sure that we don't do that.
Yeah. Laura, do you have any thoughts on that item?
So I think jumping in with Denise's theme, no one should feel that they have to be all things. And sometimes just knowing what the resource is that is available to someone. And Bob talked about the social distancing, right, and the lack of connectedness, and how for recovering people, meetings are often the way they support each other and they come together and they have a sense of community and support. For children, particularly adolescents going through their own developmental milestones, the separation and being isolated and alone, for some children, they have strived because of their predisposition toward anxiety or maybe difficulties in the school setting, and now they're confronted with maybe going back. So they have those issues. And then there's the developmental issue of needing to be with your peers and separating from your family a bit. And that is developmentally appropriate and necessary for full development. So for the employer, it's really knowing how to direct the employee. What can the school system do to help to provide supports to their child? And what are the resources in the community where the employee lives? You don't have to be all things, but if you just know how to help direct them where they feel more empowered and get access to things, and school systems for our children is so important. And the school systems are still there. They're just not there in the traditional way all the time. So I think helping them identify how would they access those things for their children is really important.
Yeah, the only thing I would add to is, there are people, so we talk about mental health issues and we talk about substance use issues, but we just also have stress associated with working from home. I have a team of women that, all but one, the poor guy is the only guy in the crowd, but they either have children or grandchildren living with them. And what happens? You've got 2, 3, 4-year-olds screaming in the background. You have a 5-year-old who's supposed to be sitting 5 hours in front of an iPad. And you've got mom locking herself in the room, hearing the door being beaten down by a kid. It goes back to empathy. Guys, it's not just women. I've seen dads with the same kinds of issues. The fact is, we're all confined to the homes that we're living in, if we're fortunate enough to have a home, and we have to make this work. And as employers, we have to help them to make this work. So we've had Zoom meetings because I live on Zoom all day, and we actually have had, my team. I'm like, look, guys, I'd rather have you participating in the call with a kid on your lap, or somebody being breastfed. We've had that too. It's okay. Do whatever you have to do, because we don't want these people feeling guilty about the fact that they're trying to be chief cook and bottle washer for everything. And just take some of that stress off by having that empathy and making it a little bit easier for people on a day-to-day basis. It's as simple as that.
So, Suzanne, if I could just add to that, I was meeting with a couple Integrity House employees, and something that we did about a year ago is that we normally would have dress down Fridays, and we expanded it to every day is dress down day. And I mean, and from what one of the employees told me, that it's such a great benefit because it's less stress for them. They don't have to worry about getting their clothes from the cleaners and getting dressed. These are for folks that are 90% of our workforce has to come into the office every day. And for those folks, they just throw on whatever they have around and come into the office, and, they're not really interfacing with the public where they need to, dress in business attire. And that is something, just a little thing that you could do to reduce the stress that our employees, have on their plate right now.
Laura and Suzanne, you both, and actually Bob, you're bringing into the family issue and the issue of increasing mental health issues in children and adolescents during COVID. So there's, worry about a depressed child at home and can significantly impact the emotional well-being of the employee. And Suzanne, you talk about that, it's sort of that dual role, when you're working remotely. So when we talk about expanding mental health services, I think it's important that we take a holistic approach that includes all family members. So Bob and Denise, I'm just wondering if we could talk about this from that standpoint, and I'll start with you, Denise.
Yeah, I think obviously I'm a family physician, so I totally believe that we need to take a holistic approach. And I do think one of the things that employers can also consider doing if your business is big enough is providing support specifically for those people with children. And that the stressors of people who have very young children are different than the stressors of people who have older children. And I do want to remind us actually that there are significant increases in mental health challenges for adolescents and young adults. And many of you actually, many of your employers actually have the young adults living back home with them as college has become virtual as well. And so just those kinds of supports are really important. Um, I will say that the other challenge that we have that I urge the state to look at from a policy perspective is just insurance coverage. I mean, again, we sort of talk about all of this kind of theoretically as if we live in a perfect world where there's universal coverage for everyone, and there's not. And so some employers, and I certainly those employers who have the means to do it, need to find ways to provide comprehensive coverage for all family members in addition to your employees. But we understand that the economics of this country, particularly the economics of this country during a pandemic, may make it may make you less able to do that. And that's a problem. That's a problem all of us have to look at, because the bottom line that COVID has shown us more than anything is that we need universal access to both physical and mental health services for everybody in this country, period, end of story. And I'm sorry to be so blunt about it, but it's just the truth, because it makes what you're describing much more difficult to achieve when we know we have people who need professional services and they can't get it because they just lack the money.
Bob, you have any thoughts on that in regards to the, that family approach?
So, I do have something that I want to add that is connected to this. And yes, we need to ensure that, we employers have business needs, but at the same time, the way that you achieve your business goals is through your workforce. So we need to ensure that our workforce is physically healthy and mentally healthy and in a position to really excel at the work that they do. The other little tidbit that I wanted to add is that prior to COVID, we had a firm policy here where remote work was not an option. We started in 1968 with a couple of individuals. We now have 250 staff, but the guy who founded Integrity House, 52 years ago, I took over from him 10 years ago. It was a firm, there's remote work is not an option. And that has changed now. And I think that the remote work option, only about 10% of our employees, maybe 15% could actually enjoy that. But I think it's working for a lot of people because they have children that are not going to school, that are doing the remote work. And yes, there is stress associated with working from home, working remotely with children in the house. But just recognizing the whole picture. I know I read something in The Economist, a study was done, and that most employees that are working remotely right now would prefer continuing a 50% remote schedule once restrictions loosen up. Most employers would prefer 80% on site and 20% remote. So the sweet spot is probably in the middle there. But I think just considering the well-being of the people that we have working for us, who we depend on to make sure that we're successful in the type of work that we're doing, is really, really important. More important now than ever in light of what everyone has been through over the past year.
Suzanne, just taking along that topic, we did hear that women are leaving the workforce at a greater rate. And again, it's all about that stress of balancing, home and childcare, homeschooling. Any, unique ways that, you want to talk about with employers to really help women stay in the workforce?
Sure. Yeah, so thanks. So, women have made such huge progress in the workforce from frontline to the boardroom, and here we are, and we have COVID, and we are seeing women, young women in particular, leaving the workforce because it's just too much to manage, as well as older people who are basically saying, you know what, life is too short, and it's time to start looking at things a little bit differently. So, but yeah, we've seen, and I've talked already about some of the challenges that we've seen. Burnout is huge. There are so many expectations on individuals, but in terms of what employers can do, it's basically cut them a break. Really consider scheduling flexible hours. People try to keep their kids and their dogs from barking in the background, but it's okay to tell them that you understand this is how it is. We get it. Let them know you get it. But check in regularly with your folks. And if there's any way that, to me, I try to deal with challenging times and controversy and things that I have a hard time with humor. And so just doing some very basic things by being available to your folks, doing town hall meetings, getting in front of your teams. We had a town hall. I now have 400 people. We just started behavioral health internally in the last year and a half. And so the entire leadership team, when we did our last Zoom call, we all dressed up as a football team and with helmets, and we had cheerleaders and we had referees. And it was basically like, look, we can be silly too. This is business. This is work. We all know it. We're going to do it, but we're going to do it together, and we're going to try to make it as easy as possible. And Horizon at Large is basically, we are now in a process of going through a reimagined workplace. And I encourage people to do it because there are so many people who are afraid to come back. And not only are they afraid to come back now, we don't know when this is going to stop or if it's going to stop. Or it'll just be again, we talk about new normal. But just some logistical things about if you're in a 20-floor high-rise or a 30 or 40-floor high-rise and you have to get people from the streets and into your building, how many people, we're going to have temperature checks. We're going to have all these things happening in the lobby. And then you got to get people into an elevator. How many are you going to let them in? How are you getting into? It's just like so many challenges. So we've literally looked position by position within this company to decide how many can actually stay home and continue to work. Because guess what? It's all worked still. Things didn't stop happening because people worked from home. And it's actually, and I'm telling you, I'm pretty sure we're going to see a huge amount of our workforce continuing to work from home in the end. And there'll be a lot of hybrids, but for the most part, I think we're going to see a lot of people working at home for the long term.
I agree. Now I want to give Laura an opportunity. Laura, what are some of the impactful things the hospital did over the last year to provide support to the employees there? I know Suzanne talked about some of the things that Horizon did, but can you talk about what you did at the hospital for your employees?
And I think a lot of what we did was done at the time it needed to be done. So it made sense in that moment of the peak of the pandemic to round and physically be there in the units with staff and provide support, resources, reassurance, get feedback from them on the things that they need. And that was at that peak time, last April. And I talked about the Zen spaces where we created spots for people to kind of exit and just decompress with each other in a responsible way, but still gave them that time. And now I would say over the past maybe 6 months, really looking at the impact of racism and looking at that as a trauma itself. And so how do we understand it? How do we treat it? Do we look at it when we're looking at issues around anxiety, depression, and we're doing an evaluation? Do we understand how racism has impacted this person? And have we had any training in that in our mental health folks? So we partnered with an expert, Dr. Monique Swift, who is going to train our behavioral health staff to really understand racism as a trauma, as they're doing all of this new work through telemedicine and telepsychiatry, and all of the therapies we've always done have not been researched in that forum, but that's the forum we have. And so we'll have to look at how is that working, and we have to add new innovative things to look at based on what our community is experiencing. So I think those are some things. I'm really dealing with real-time issues and providing real resources in response to the need that we're hearing from our patients and our staff.
Stephanie, I have 2 audience questions, but I thought that Denise might want to comment on that last piece before we get to the audience questions.
Um, I was actually writing down Monique Smith's name at the time. So what was the piece? Because
I will share it with you, Denise.
yeah, good. Thank you. Um, there are two aspects of this. So there's the national aspect related to George Floyd that we're living with at this moment, and literally at this moment as we await the verdict and the trauma that many of us have been experiencing for the several weeks of reliving what happened over and over. But what I am struck by is there are a subset of people who don't want to deal with this issue. And so we act, many of us, when we talk about racism, we act like everybody's on the same page with us. And there are huge swaths of this country that are not on the same page. And there's huge swaths of people that many of you as employers listening have in your workplaces who are not on the same page. And so the other challenge that we have as we are dealing with this uh, is how to foster respectful and appropriate dialogue around issues related to racism, but doing it in ways that don't further the trauma that many people of color are currently experiencing. Because one of the things we know about the United States historically is that whenever we put too much focus on race and eliminating racism, there's a huge backlash in this country. And that backlash pushes us backwards in powerful ways. And I certainly have fear that we may be entering that period of backlash yet again. And so we all need to be very mindful and very careful and very deliberate in how we address this issue of racism, not only in society as a whole, but looking at what's going on in the workplace as well.
Great, thank you, Denise. The two questions, the first one, and for both of these, perhaps we can do separate follow-up, but one of the questions was about victims of domestic abuse. With the workers working remotely, they're exposed to the abuser to a greater degree. And the question related to how can an employer help an employee where they know of a situation that somebody is experiencing that. So if you want to follow up with me on that, if there's not an immediate answer, and I can forward that to the individual.
Let me just say, Barbara,
one,
related to that, one of the things that's very important to do related to those kinds of issues is to put out information about resources related to domestic violence, for example, for everybody. So don't assume that you think you know who may need this information, and put information, very often organizations will put information in bathrooms so that there are cards that people can take and say, if you need help with this. So it's not public who takes the information, but you want to normalize it because we actually can't predict who's experiencing that in their lives.
Great. And I also mentioned to the person in the chat that there's an organization that's a member of Partners for Women in Justice. And it's a really wonderful organization that it's teams of volunteer lawyers who go to court with women who are experiencing domestic violence. So that's one resource that we know of. The other question was posed as an or, but I think the answer is an and. And the question related to, should someone who's experiencing depression take antidepressants or do self-care and practice yoga and mindfulness and things like that?
So I'll take first stab, and Denise, please fill in from the healthcare perspective. So when you do look at best practice and the optimum outcomes, it is a multi-pronged approach. So you're talking about formalized talk therapy, you're talking about psychotropic medications that are appropriate based on the symptoms the person is having from an expert in treating that. And all of the other therapeutic activities bolster the impact of the formalized treatment that you're doing. So, if you really want to have that best outcome possible, you're talking about multiple intervention strategies, not a one, and one size never fits all. So if one person feels that medication is really what helped me, the next person might say, oh, it was really the talk therapy that helped me, or the working out. So multiple attacks on the condition are really the going to give you the best outcome.
I think the only thing I want to add is to really remind people that depression and anxiety are diseases. We actually understand the biological basis for a lot of this increasingly well. We would never say to a diabetic person, oh, you can stop taking all of your diabetic medications and just rely solely on diet and exercise if they are severely impacted, right, by their diabetes. And similarly, I mean, part of it, we want to take the stigma away from people needing to take psychotropic medications. And as Laura said, the best modalities for treatment include a number of these things together. But please, as employers, you almost want to give permission to your employees to do what they need to do to take care of their mental health. And for many of them, that may include taking psychotropic medications because it makes a difference for a lot of people.
And I'm
Okay,
sure Bob would agree. I'm sure Bob would agree too, like even on the substance use side. So the best practice out there, gold standard for opioid use disorders, et cetera, is to do medication-assisted treatment. And that's okay. And so, there's a stigma associated with this. People say you're just replacing one drug with another. That's not real. That's not reality. It's a diabetic taking their insulin. This is the same kind of thing. And that's the whole mindset that has to change. Is this is just like your brain's part of your body, and it's all connected, and we're all one person. Treat people like people, not conditions. So it's okay. And we should encourage people to do that because that's their greatest chance of long-term success.
Okay, thank you, everyone. I am going to turn to Chip in a moment. I just want to acknowledge Maya Curry, our communications director. Maya has been behind the scenes and running presentations and making us all look good. So I'm very grateful for Maya's work on the NRBP team. And with that, it's my great pleasure to turn back to Chip Halleck, our president and CEO, to close the program.
Thanks, Barbara. And I'll tell you, this has been a very compelling hour and a half that went very quickly, and there's so much good information being shared. And just want to thank you all. Stephanie, thank you for managing this conversation, and Denise and Laura, Bob, and Stephanie, or Suzanne rather. Thank you all for contributing to a really rich conversation. And I feel like it's been this conversation has been kind of an emotional roller coaster. Listening to, starting with the statistics that Denise used and others of you used in your presentations, and then thinking about how, today we see a lot of encouraging signs, right? With more people getting vaccines and being outside and warmer weather coming and schools reopening and some people coming back to work, there's that good side. And then what you've presented today really is a reality check. And while we are making progress, and we should be happy for that progress and add to it, we still have a lot of enduring challenges. And I think the question is what we can do, all of us collectively as employers and as friends, to address some of those enduring challenges. And just a couple things that I think were mentioned by all of you and stand to be reinforced. Removing the stigma of these challenges is certainly at the top of the list. Leading and managing with empathy, as you talked about, and addressing needs with real concrete actions on the part of employers is so necessary. And there are treatment options out there, and you've done a good job this morning of describing many of them. And we certainly look forward to sharing more of those resources with our members in the days ahead. And then finally, self-care is not elective. It's a must-do, and everybody really needs to think about themselves and do what they can to help themselves and help those around them. So I just want to thank you all. I also want to, as Barbara did, I want to acknowledge Barbara's work in putting together a really compelling presentation, and thank Maya and Nikki and Charisma, who are also on our team here at NRBP, working to address the needs of our members on a consistent basis. And we look forward to being a resource for you going forward. Finally, a great big thank you to RWJ Barnabas and North Beth Israel Medical Center and Daryl's leadership, both in the healthcare setting as well as in this organization for so long. And thank you as well to Horizon Blue Cross Blue Shield for supporting this morning's program. And finally, New Jersey Advanced Media for helping us spread the word about offerings like this and other programs that we have throughout the year. So with that, once again, thank you all for joining us this morning. We held an audience for a very long time, and that's a credit to all of you presenters and all of you employers who are looking to do the right things by your workforce. So with that, take care, be good, be well. Thank you all.